Mic check 1 2 1 2. Mic check 1 2 1 2.
Good morning. I'm Muriel Bowser. I'm the mayor of Washington, D.C. I am here to talk about a heinous crime in our community and to ask for the public support in bringing justice to a 15-month-old baby and his family. Before I get there, I want to make a brief announcement of our experience with COVID. I'm joined today by the Chief of Police, Peter Newsham, and members of my public safety team, as well as Ashawn Benedict, who is in charge of the ATF for the Washington region. We reported today 322 new cases of COVID in our community, and those are probably rivals a high in new cases in a single day. We want to remind people to be extra cautious of what they do when they go out, and extra cautious of social gatherings in their home. With the vaccine going through the approval process, there is light certainly at the end of the tunnel, but we all need to get there together. And as we learn more about the rollout of a safe and effective vaccine, DC Health continues to plan for an equitable distribution of that vaccine throughout all of the phases of deployment. This morning, we sent a letter to our partners at Operation Warp Speed to increase the district's vaccine allotment. The current proposed allotment is based on the district's population, but we are unique in a unique region, and approximately 75% of our more than 80,000 healthcare workers are residents of Maryland and Virginia and not the district. So the allotment that we would receive would not cover all of our healthcare workers. So we will keep pushing to get the resources that we need and continue to keep you posted. I now want to talk about the tragedy that took place last night in our city. There are simply no words for the sense of outrage that we should all feel at the loss of this beautiful baby boy, Carmelo. We're all sick of the heinous crimes in our city. We talk a lot about gun violence each and every day and the havoc and pain that guns are causing in our city. We talk about the people who are using guns in our city who have no regard for human life. And we also need to talk about accountability for those who indiscriminately shoot guns and kill people. Now we have lost a 15-month-old precious boy, and we need to spend more time talking about the victims. The level of senselessness is impossible to process, and we need everybody's help to bring justice to this baby Carmelo and his family, and to get a very dangerous person off the streets. It goes without saying that MPD needs our help, and you can text anonymously information about Carmelo's murder to 50411. You may also call 202-727-9099. On behalf of our entire city, I share my prayers and condolences with the Carmelo's family and implore the shooter, the killer of this baby, to come forward, and anyone who has information to also provide it. We're grateful to the FBI and the ATF for providing additional reward money. Those who have information leading to an arrest and conviction of Carmelo's murderer could receive $60,000. With that, I'm going to ask Peter Newsham to provide details, and then we will take your questions.
Good morning. Thank you, Mayor Bowser. I don't think I could have said it better with the level of unhappiness and unfortunateness that we experienced last night. Yesterday was a particularly difficult evening for me as we lost an innocent child to gun violence in our city. This is our 187th homicide this year. And Carmelo was the youngest homicide victim of gun violence in our city so far this year. Each of you know my stance on illegal firearms, their prevalence in the district, and MPD's commitment to remove them from the hands of violent offenders, but that's not what I'm here to talk about today. Today, my energy will be spent on bringing the community together to find the person or persons that are responsible for killing this beautiful little boy. As you may be aware from my briefing last night, at about 9:35, a little after 9:35 p.m., our shot spotter technology detected multiple rounds in the 6th District. The police officers in the 6th District were dispatched to the area of Central and Southern Avenue, Southeast. When they arrived on the scene, they were advised that prior to their arrival, a baby victim had been transported to an area hospital by DC Fire and EMS. I want to pause for a moment and recognize, I talked to Chief Donnelly this morning, the teams on Engine 30 and Ambulance 30 and their heroic efforts to try and save this little boy. Unfortunately, it was learned that the 15-month-old Carmelo Duncan had sustained multiple gunshot wounds and he was pronounced dead at a local hospital. Carmelo lived in Southeast Washington, D.C. As the mayor mentioned, this is an unfathomable tragedy, and my sincere condolences go out to Carmelo's family. Many of the family's friends and other family members gathered at the hospital, and I also want to say to those friends and family members, on behalf of the Metropolitan Police Department, the only thing that we can do to help solve your pain is try and find the person or persons who are responsible, and we will make every effort to do that. What the investigation revealed, that the shooting appeared to have occurred in the 5700 block of Southern Avenue, Southeast. The vehicle that Carmelo was traveling in was struck multiple times, and there's evidence on the scene that indicates that more than one weapon was used. We know that Carmelo was a passenger in the vehicle. The vehicle was driven by his dad, and there was also, we believe, another child in the car. Neither the father or the other child received any injuries. We are obviously going to continue to canvass the community for any possible video. If we do come up with images of significance, we will share them with you. I am convinced that the members of our community will not tolerate this. I will reiterate what the mayor said with regards to the folks that are responsible for this. You need to come and turn yourself in, because we are going to make every effort and spend as much time as we need to find the person or persons who are responsible. The only thing that we have right now in the way of a lookout is a dark gray SUV with heavily tinted dark windows. And anybody that was in the area or who lives in the area that may have seen something like that last night around 9:30, you can either text us or call us on 202-727-9099. You can text us at 50411. I want to thank the FBI and the ATF, Ashan Benedict. Thank you very much. Ashan and his team reached out to me immediately and said that they wanted to increase the reward money that was available in this case. And as the mayor mentioned, the reward that is available for an arrest and conviction in this case is $60,000. We can take any questions that you all might have.
Hi, Sierra Fox, reporter at Fox 5. Homicides are up nearly 20% compared to last year. What's the root cause?
What's the what?
The root cause, you think?
It's too many guns in the District of Columbia, too many illegal firearms in the District of Columbia, too many folks that are out in our community that think it's okay to use them like just what happened last night. If you have a dispute with somebody, the way to resolve that dispute is not through the use of firearms. This is exactly what we talk about. This is exactly what can happen. You look up on the board and you look at the picture of that little child, that little baby, had his whole life in front of him. Somebody thought it was okay to fire a gun off in our community, in one of our neighborhoods, and now this little baby is no longer with us.
And you mentioned illegal firearms. Do you believe illegal firearms were used in this case?
100% they were. And the other thing I can tell you is there's a very strong chance, if you looked at historically, that there's a 50% chance that the people who fired that gun have been arrested with a firearm before, and they probably are under some type of supervision, in the neighborhood of 35% chance of that.
Chief, I heard that we talked about Engine 30. They were already there for another call, I've heard. Can you tell us anything about that?
Yeah, the chief told me that. Chief Donnelly told me that his team was up there responding to a medical emergency. The engine company was up there and the ambulance was up there. And, you know, I heard reports from the scene and I talked to the chief, and you know, DC Fire and EMS doesn't get enough credit for the way that they try to save lives, but they responded heroically. They got that kid to the hospital as quickly as they could, and unfortunately, the result was not one that any of us wanted.
The idea I got was the father was driving and saw them and just, you know, and just stopped.
That's what it sounds like. Yeah, you know, Sam, I don't want to get into that level of detail, but that's what it sounds like occurred from the witness accounts.
The father, you know, and I know this is probably silly at this point, but do you have any idea why they were shooting at him, or were they
well, you know,
right car?
Here's what you got. Yeah, Sam, you know, you got to think about this. This is a father who just lost his infant child, and the level of, you know, being distraught over something like that, being in the vehicle when something like that occurred. We're going to take our time. We're going to try and help the family as best we can, and try and get as much information as we can, because I'm absolutely sure that Dad and Mom and the rest of the family want to ensure that the persons that were responsible for this are held accountable.
You said more than one gun, so anything else you can say there?
All I can tell you is we have forensic evidence to suggest that more than one weapon was used. I don't know. We're not to the point yet where we can report on how many different types of rounds hit the vehicle, but there is evidence to suggest that more than one weapon was used in this case. So it's an indication to me that at least the vehicle was targeted, and this was not random.
So it was intentional?
It very much appears that way. Yes?
Was Carmelo in the backseat of the car at the time?
It appears that that's the case. I can't say that with certainty. I can tell you there was a baby seat in the back when I was up there last night, and most of the reports from witnesses indicates that he was in the back seat.
In the baby seat?
I'm sorry?
In the baby seat?
I can, you know, I can only assume that, but I don't have that level of detail.
And based on your comments earlier about the father, has he not been cooperating so far?
I can tell you this. I can't even begin to imagine what Carmelo's dad is going through. I think he probably is cooperating to the extent that he can. We're going to have to give him time, and I'm absolutely certain that he will assist us with this.
You mentioned another person in the car. Is that Carmelo's brother?
We don't know. Okay, thank you.
We'll take a few more questions. Yes, Bennett?
With this issue on Operation Warp Speed and getting vaccines based on place of residence instead of place of work, have you gotten any response from the feds? Like, what are they saying when you're raising these concerns?
I think that they take a lot of feedback. Dr. Nesbitt is our primary liaison on all of the committees and groups that are meeting about the distribution of the vaccine. We continue to raise this issue up, and we're going to continue to work it.
But like, are you hearing anything back from them?
Yes, they're still working on their deployment plan. Yes.
So are you considering a plan where you would not vaccinate Maryland and Virginia residents and only vaccinate DC residents? And to that same question, have you reached out to Governors Hogan and Northam to talk about if there's a way the three of you can kind of figure this out if the feds don't acquiesce to your request?
We think, as I said, and I'll have Dr. Nesbitt answer more fully, but the recommendation to inoculate healthcare workers is, we support that notion, and we think that makes DC residents safer. Similarly, we allow Maryland and Virginia residents to use our testing sites because we know they work here, and them being able to isolate if they have an infection makes DC residents safer. And we think a vaccination strategy along those lines makes us safer as well. Again, Dr. Nesbitt talks to our national and regional leaders about the same.
Sure. Thank you, Madam Mayor, for that, and I'll elaborate just a little further. The allotments for each state are not made completely available to us, but we have discussions regarding that. As early as this morning, Governor Hogan made public statements in terms of they are receiving an allotment that allows them to vaccinate 50% of their healthcare workforce. So just by that comparison, no one is receiving enough to vaccinate 100% of their workforce in their first allotment. So we fully appreciate that and understand that. But recognizing that the vast majority of states are receiving sufficient supply to vaccinate 1/3 to 50% of their workforce in the district, because of this staunch policy position that the allocation should be based on resident population and not workforce population, significantly disadvantages the district if our allotment allows us to vaccinate 1/10 or 10% of our healthcare workforce, while other states can quickly vaccinate 1/3 or 50% of their healthcare workforce. That's just not the definition of an equitable approach to vaccine allocation. So what we're asking is that they provide that. As the mayor has stated, we know that our healthcare workforce resides in Maryland and Virginia, and other essential workers, as we move through subsequent phases, will have that same, will face that same challenge because of what our daytime population demographics look like. It is safer for the district for us to adopt a recommended approach. This is not something that we've come up on our own. The Operation Warp Speed and the CDC actually recommend that you have an approach that vaccinates according to state of workplace versus state of residence. So we're kind of caught between a couple of policy recommendations and decisions that the allocation doesn't align with. So it's safer for us to, as the mayor says, continue to take care of the people who work here, which has been a policy that the district has adopted for a long time because it protects the people who live here. We want to continue to do that.
All right, just a couple more. Yes, Sam?
Mayor, could we hear from Special Agent Benedict?
Sure.
The reasoning for the ATF's thought?
Good morning. From ATF, we also offer our thoughts and prayers and condolences to the family of Carmelo. So ATF Washington Field Division, our duty is to support the citizens of the District of Columbia. So as a sole federal agency dedicated to firearms suppression, violence, gun trafficking, we partner with MPD every single day to investigate cases like this. This one jumps out at you. Immediately, my team alerted me that a 1-year-old was killed last night. And that's unacceptable to me as a citizen of the District of Columbia, and I think everyone should feel the same way. But we join these cases with vigor, and we will partner with MPD and the Mayor's office to bring those to justice.
How much did the ATF contribute?
$25,000.
Thank you, Lieutenant.
So the health department told us this week that you have a policy of not disclosing case clusters when we asked about cases linked to the MAGA March. Why does the city have this policy when you've disclosed outbreaks at Georgetown Church and related to the White House before? And how does it help public health to not tell residents where cases are originating from?
I'm not sure I follow your question.
So when we're asking about cases linked to the big MAGA march of thousands of people marching without masks, we were told that the health department has a policy of not disclosing case clusters. Why is that policy in place when other jurisdictions are disclosing sources of multiple cases?
Well, we regularly report, Finna, as you know, on what are some of our contact trace data indicates. And some of them people can have multiple exposures, and we continue to report it that way.
So it's because that you're saying that you're not reporting case clusters because you can't say it's a case cluster?
In the case of the MAGA March, and then I'll let the epidemiologist boss speak to this a little bit more. But in the case of those marches and demonstrations, people have attended those, they've attended small events, they've traveled to get here. We have people who have worked from our side, police officers and others, and fire department personnel who have worked those marches. And so I think our policy of kind of looking at events that create a lot of activity, including traveling for Thanksgiving and Halloween, we look out a week or so, 2 weeks from those events, and then you can draw conclusions of whether that additional activity created more cases.
So we've been asked on a number of occasions about cluster data. If I can correct for the record, our response is that we have not published that data. We will, when we have data that can be published, we will do so. Thank you.
So you will disclose data?
When we have data that can be published, we will do so.
What does it mean can be published?
When we have data that can be published in the appropriate context, when people understand it and it's not misconstrued, we will do so.
Okay, that's it. And let me just say, I understand that Fennett is blowing the popsicle stand of our beat for the City Hall beat for the Washington Post, but staying with the Washington Post and covering, I think you said Biden administration and healthcare. So we want to thank you for your service to the people of the District of Columbia. Thank you, Fennett.
Thank you, Mayor.
Okay, and Mark.
Can I ask about the DCPS numbers and what you could tell us about? We're told that the positive case numbers for staff and students does not come from CARES classrooms. Can you tell us what classrooms, what schools, and what the denominator would be? How, you know, of the positive cases that we are seeing in DCPS, how many people were actually tested? What universe does that come out of? To give us an idea of.
And you're asking me, we have a protocol about how we're going to talk about school numbers, and that protocol is being followed. And Dr. Nesbitt may remember all the details of it better than I do. And so your question was?
Well, what schools were these positive cases from? What class? I mean, if they're not CARES classrooms, what classrooms?
The other school activity that we have relate to like the support model, and those have been ongoing since August. So various schools have different types of clubs or opportunities for kids to meet in person that is not in the clear classroom setup.
Okay, so is this all one school? Are these different schools? The 10 staff and 1 student?
I don't know that, Mark, but the way we're going to report schools data, we have that any in-person staffer that's at a school is reported. That could be, well, they're not teachers because there are no teachers reporting in person, but it could be one of the support staff in the building, or it could be one of the partners in education that are leading the CARES classrooms. That's not the case in this case, but it could be. Yes.
Mayor, I'd just like to hear from Dr. Mitchell what he has to say about this case overnight. It's your ear.
Good morning. I'm first, my condolences go out to the family. I've spoken to the mother this morning. you know, we've gotten to a point in this city where if we're not affected by this violence, then we don't have a pulse ourselves. I truly believe that there's an opportunity for us to stop the gun violence. I truly believe that there's an opportunity for us to lead this city towards that end. But I believe also there's a responsibility for each and every one of us to be part of the solution. That this solution is not purely a government solution, but it's going to take both community and faith leaders and nonprofits and for-profits and business tables and entrepreneurs. It's going to take all of us if we're going to lead towards a decrease in violence in this city. I must say that the ground is calling out. There's too much blood that has been shed in this city and in this country, and so my heart is aching. My heart is aching, and I believe that we truly have an opportunity. And so, just to echo the words of the chief of police, if you know anything about this case, if you know anyone connected to the murderers of Carmelo, then we need to step forward so we can also bring people to justice, but bring closure and bring healing to the family.
Is there any comment that you can make regarding your conversation with the mother?
Well, again, you know, in my role as the chief medical examiner, I make contact with families. And so just knowing that she knows that the city is here for her, and that my office is here to support her, particularly during this time. And so we will continue to work with the family.
Okay, last question.
All right, I've got a very confrontational and pointed question for you as my last one. What do you think about the John Wall trade?
I don't know anything about the John Wall trade, but I'll find out about it and comment at a later date. Thank you, everybody.
Hi, John. How's it going?
Yeah.